dive in.
Sure.
Steven, welcome, man.
Glad to be here. Thanks for having me.
Welcome to Chicago.
It is a mostly beautiful day.
In true Chicago fashion, we showed up when you came here to collect some hardware.
Yes. I got an award from Behavioral Health Business for Future Leader. And so anyone sort of under 35 doing work in the behavioral health space, they recognize that's doing kind of things that move the needle. And so was appreciative of that, even though probably my mother is the only one that cares and keeps track of that stuff. But yeah, glad to be here.
Well, I appreciate it. And, it just seemed like it made too much sense to catch you while you were in town. Doug was kind enough to introduce us, and shout out to Project Management Advisors for giving us a space downtown to make it easy for you to grab some hardware, shoot back over here. So you're in an all-week conference?
It's part of the week. It just wrapped up. And it's fascinating worlds of behavioral health business investment. So you have investment, finance, operators, and clinicians, as well as vendors, all come together.
Nice. Well, let's talk a little bit about, take a step back and talk about your background. What do you do? Kind of how you got into the architecture space. And then there's obviously some things that are really relevant to this award that you've accepted. So why don't we just start from square one, tell everybody who you are and what you do, and we'll go from there.
Yeah, sounds good. So Stephen Parker, I am an architect and dedicated behavioral health planner at Stantec. I work in the Washington, D.C. area, and my focus of the practice is mental and behavioral health facilities of all shapes and kinds, from inpatient psychiatric, of all acuities, addiction treatment, developmental disorders like autism clinics. We say that we have a practice of purpose, working with communities in crisis, designing for humanity at its most vulnerable, and individuals in recovery. So that's kind of the emphasis of where we are focused at this area of practice at Stantec. And Stantec is a publicly traded company headquartered in Canada. We're a big architecture and engineering firm, and we're in 6 continents and hundreds of offices around the world. And they have a focus in mental behavioral health, so they brought me on and other partners to kind of meet that demand that has really been burgeoning since the pandemic. But I would say it's demand that's probably always been there, just we're recognizing it and kind of finally meeting it effectively with design that makes a difference.
That's awesome. I mean, there's a huge need in conversation right now surrounding behavioral health. Obviously, after the past 4 years, a lot has changed, and I think behavioral health, our mental health and well-being, everything has become more front of mind. So what really inspired you to get into behavioral health and to be in this space? Because obviously you're very good at it, but what got you started?
Well, I like to think I have a very good team that supports me in it, first and foremost. You never do it alone. So for me, it's probably equal parts interest, education, and experience. Interest from my family background. My namesake is a family member who died of addiction. My godfather is a veteran. My father has been admitted to a facility twice. The last time was the week my son was born. And that really does kind of hone your sense of focus in my practice, at least. And my educational background doing healthcare design is my thesis work. My buddies were coming back from Iraq and Afghanistan 10 plus years ago, talking about sharing stories around traumatic brain injury and PTSD. So that was the focus of my thesis work. Trying to design for family members who are dealing with this, because when an individual is in crisis, it ripples throughout the family. It just doesn't affect one person, but their entire support network. And then my experience for the past few years doing and focusing in on this work, small autism clinic for Kaiser, helping the VA develop their inpatient mental health design guide. So it's the largest healthcare system in the country with the most amount of mental health patients. And so the idea, we spent years doing the research, touring the facilities, developing the design concepts and strategies that would help veterans in their most dire moments, and that would influence facility design for years to come. And then at Stantec, it's been really great for the last couple of years to focus in on this exclusively as part of our practice. So we've done over 1,000 beds in the last 18 months alone, design, plan, so forth and so on. So that's kind of where my background is and how I got here.
Well, I think it's an amazing story, and I think it's great to have purpose in our work. And I think that it's great that behavioral health touches all of us in some capacity.
Mm-hmm.
I don't think I know a single person that hasn't had some experience with behavioral health and what that means. And I think obviously everyone is looking for solutions to improve mental health and well-being, because I think it's something that in some capacity we all experienced mental health and well-being during the pandemic.
Mm-hmm.
I think, that was probably
Absolutely
the most unprecedented time where everyone was kind of forced to adjust and
mm-hmm.
get used to the new normal for a little while with a tremendous amount of uncertainty as if it was ever going to go back. But you talked a little bit about care culture
Mm-hmm.
when you and I first met. And I think it's worth sharing a little bit more about that, because I think it's worth hearing some of the things that we're working on to
Mm-hmm.
improve design elements to improve mental health and well-being.
Yeah, I think there's a lot to unpack depending on the facility, the patient, the acuity. There are all these different considerations and constraints, and so there's not a lot of universality, except for the fact that it's really humanity at a really vulnerable point in life, whether that's from addiction or mental health or a combination thereof, or developmental disorders that have led into a crisis moment. So I find that a lot of the more meaningful conversations I have with clients, that I have occasionally with patients or people we call that have lived experience. It's a term that came over from the UK for individuals that have been admitted to facilities, have had gone through crisis, and they talk about these moments where they really lacked dignity, they lacked autonomy, these things that aren't really kind of captured in a care model, a model of care. The model of care is kind of really about that treatment and how the staff sort of functionally approach and provide treatment. Whereas I find that the conversations we have in these workshops, where looking at a new facility, sometimes if they had an existing facility, you kind of walk it, you do observation, you do surveys, you do interviews, and trying to get a feel for how the place works. And one thing we touch on a lot is that sense of care culture. What do they aspire to do better? Is it the engagement and rapport they build with patients? Because the safest facility, from what we hear, is ones where the patients see providers as human beings and providers see patients as human beings. And so how can you break down the barriers that maybe create a dynamic of authority or an us versus them? And that can be as simple as, I use this example quite a bit, if a patient is trying to sleep and it's very stressful if you don't sleep, as a new father, I understand that very well. If they can't regulate their own sleep simply because they can't control the blinds in the room, and they have to go to our care desk and ask a nurse to go and open and close their blinds every single day, something we may take for granted, that we get a good night's sleep because the sun doesn't wake us up, or we can go to sleep when we want to. And that relationship that you're building because you made a design decision to add something or not add something, provide a sense of patient autonomy and dignity in a safe way, in a therapeutic way, means that you can maybe have a relationship that's no longer transactional, about going to that care desk not to ask for something that all of us would probably take for granted, but to go there when you feel like you want to open up, that you want to build a relationship, which is how you create a therapeutic alliance, as they call it. And so you can make a design decision that can either foster or hinder those types of relationships. And so sort of walking through those conversations about the aspirational care culture that this facility wants, not just the care model they're looking to implement, can have a huge transformational impact on the patient experience, the likelihood of being aggressive or learning the tools they need to deal with crisis in the future, but also for providers, for staff. There's a huge issue with staff retention. And so I think that really can come down to culture and what design in some way can help with that.
Well, and I think traditionally those patients that say, oh, I can't sleep, the first move was always to go put pen to paper and prescribe. And as somebody who I've worked in behavioral health and addiction treatment on the life sciences side to help with some of the testing metrics for those, and also medication management, reconciliation, it's amazing to me how something as simple as blinds impact somebody's sleep. And it might not be something that the physicians or the clinicians are thinking about because they're in the mindset of diagnose and prescribe. And not all doctors, but it typically has been the traditional model of Western medicine. And what I admire about these opportunities and these conversations is to shed some light, no pun intended, on how these simple approaches in design can completely change health outcomes.
And the thing is that we talk about health outcomes, but we lack a lot of emphasis around the research to really prove the outcomes. We know from the designs that we do, every building is kind of an experiment, and we learn better, and we hop on trends, learn from fads, but design for values. And so really uncovering what those values are for the organization that we're designing for, and understanding like the passion and the sense of purpose in the providers and the clinicians and the staff there, and really trying to translate that in the design is kind of what really brings me joy in my process and my work. And it comes down to a million little things or a couple of big things. You can definitely set up spaces where you need to provide safe line of sight. But how do you do that where patients don't feel like they're observed? So they have the psychological safety and the feeling as if they're not always kind of under a watchful eye, but they need to be. Where do you place the chair for a sitter? Someone whose only job is to observe and report. And then asking that person, their perspective when they spend their entire shift just keeping an eye on someone. And that's all their job's supposed to be. They can have a huge impact on the patient experience by how comfortable they are, or their attitude towards the space, or those types of interactions. We don't always look to get that perspective when we go and do stakeholder groups and so forth. Partially that's our own biases, and we're unaware of things, the biases that we all sort of are unconsciously carrying around with us, whether that's a provider or a designer or facility owner. So I think there's a lot of opportunity to kind of take the societal awareness around mental health that has really come since the pandemic, to really meet the demand that's always been there and recognize we can do better. And it's different for every organization that we work with, because we work federal, local, state, for-profit, nonprofit, and in a lot of different countries too. So there's a cultural context for all of this as well that just kind of needs to be layered into that design process.
Well, we had talked earlier, what really stood out to me was when you had talked about every project's being different, but it also has reliance and dependencies on where that project is specifically located. Let's go back to talking about zip codes and where you grow up and the impact that has on mental health, because I don't think people often realize how much that weighs in. We always think about genetics as being a predisposition, but you don't think about your zip code. So obviously, I think these designs are dynamic because every demographic and every zip code where you're doing work and where we build is impacting how we make decisions in those spaces. So what are your thoughts on that?
So there are pretty obvious examples that probably have a little bit more research and notoriety is red line neighborhoods where individuals and minorities, people of color were exempt from. And so they were either forced to build or live in other places that were exposed to higher levels of toxins or air quality contaminants. The sheer number of lead poisoning kind of incidents in certain neighborhoods and housing stock that directly led to developmental disorders in children is a fairly easy one to identify. Less so with things around like shade equity. The number of trees and the ability to walk down safely and not feel as if the 15-minute, 30-minute, 45-minute walk to a bus station or the train station, if you're lucky enough to have mass transit, dictates whether or not when that person does show up at work, their quality of, sort of psychological well-being. For example, the number and quality of parks and neighborhoods. I think we all understood in the pandemic the value of outdoor space. When you didn't have your commute to rely on getting outdoors, if you were kind of stuck in your home, the value of having a balcony if you were in a city or a backyard if you had one, and just getting out into nature and connecting with nature and kind of all the biophilic and biomimicry aspects of design that we try to fold into spaces when all you have to do is go outside and hopefully if you have good air quality. That's not always the case in some places, but access to nature visually, physically. There's lots of evidence-based design studies that kind of relate to that. And your zip code depending on the investment of your city or locality, may not have those parks, may not have that green space, may not have that connection to nature, may have just generally poor mass transit options, things that give you a sense of mobility as well. It's very easy to feel trapped, I think, during the pandemic when you're kind of stuck in your house, when it was your workplace, your schoolhouse, your playhouse, and the people around you were all the socialization you got as well. So I think there's something you said about unpacking like the zip code's impact on your health and health equity. There was a conference we just did in Berlin for the ULI Health Leaders Forum. So it's a fellowship program year-long that has about 30 participants in about 9 or 10 countries represented. But 2/3 of them are in the U.S., and they're either planning officials or healthcare administrators, and they're all sort of dealing with health issues in different ways, like school nutrition programs. Like if you don't have like healthy nutritional options in your neighborhood, it's a food desert. And nutrition has an impact on your psychological well-being. Some medications you need to take like B12 to actually be effective. So none of these things are in isolation. I think medicine in and of itself is trying to be more holistic, but unfortunately we're all sort of experimenting and trying to do better. Hopefully we have the will to do so.
Well, and I hope so too, because the one thing that stood out to me is we keep mentioning parks because we're both new dads.
Yeah.
We spend a lot of time in new parks, and you know, as a dad of an almost 18-month-old, and you've got a 6-month-old, I think that sense of their mental well-being is so important, developmentally, psychologically. I mean, the days where Max gets out into the park, you know, and gets to run around and meet new kids and emulate actions from older kids, and we connect with parents. You have the sense of community. So it's not just for his well-being, but for ours as well. And there is something psychologically about entering that park space, and you just feel a sense of finally being unplugged for a little bit, because it's like that's our time. And, you know, it's tough, though. You have to be very intentional about it. You know, I do my best to leave the phone in the stroller or leave it at home and just try to enjoy the few minutes that we have in that space. But, you know, the up-and-coming generations are so important. Can you talk a little bit about how design really impacts the youth coming into these spaces? Because I think if you can really focus on the design elements and the foundations of where these kids are spending most of their time, it bodes well for the future of their mental health and well-being.
Yeah, and I was having these kind of revelations in various settings. So I was in South Carolina a few weeks ago. We're part of and kind of contributing to the research around pediatric behavioral health and emergency departments. There's a research study going on at Clemson University, my alma mater. They got a state grant to look at these specific issues. So we provided some case studies within the Stantec portfolio, and we participated in their workshops because post-pandemic and even before then is just between youth suicidal ideation, you know, the lack of socialization they didn't get during the pandemic, going back to school settings and kind of dealing with the ticking time bomb, if you will, of some issues. It was really great to see the research and people gathering around that sense of purpose for the specific issue. Part of the conversations we had is, you know, most clinicians will tell you they really wish their patients didn't have to come to their front door. They wish it was more preventable, how to do so, how to deal with that in the community at the point of need. The high school that's actually up the street from me has had some overdose issues, and so they hired 8 new behavioral health counselors. And the students have been very vocal and protesting, so they're actually advocating for themselves, which is astoundingly awesome. But the design of those facilities, sometimes we're called in to think about sensory environments for children on the spectrum or developmental disorders, or generally just mental health in the educational setting, and how to equip them and provide spaces for them to self-regulate, to de-escalate, to self-soothe. I think there's a notion sometimes that we grew up with like timeout rooms are now like de-escalation rooms or now sensory rooms. So there's a connotation difference that has changed from generation to generation as well, that goes to about the value of preventing issues before they become something that requires inpatient care or more interventional care. And the idea that these spaces that we could design are for broader spectrum, for folks that are looking for specific stimuli, that seek it out, that help them soothe, that seek out no stimuli to seek to get rid of all of them if you're hypo or hypersensitive, how to live with that spectrum. It's not simply just putting in dimmable lights or colorful lights. It's the color spectrum. It's the Kelvin rating. It's the tactility of the environment around that they can go and self-soothe by finding those sensory inputs. Dynamicism, like how can they rock? Can they move themselves around? For kids in particular, when we look at inpatient units, large muscle movement, how they can get recreation therapy, expend that energy that, having a 6-month-old who's definitely gotten to the phase of trying to crawl and flipping himself over and like, oh, he's got a lot of energy to expend. Now think about that when you're in a lockdown inpatient psychiatric facility and there's a lot of energy to expend and not a lot of outlets. And so the more preventative I think we can be with how we address youth mental health can manifest in a number of ways. There's a great facility up in Toronto we just finished called Stella's Place. It's a youth mental health hub. It's like a recovery cafe model, which is basically, looks very casual. Looks like a coffee shop or maybe a study hall in a university. And the idea is that you could drop in there anytime. It's a safe third place that isn't clinical. It's not institutional. And the kind of emphasis around peer support. Someone who's gone through something like a crisis and has gone through recovery and has gotten some training, and so they can kind of talk to you authentically and at the level that you would understand as a young person going through something similar. And then they can kind of, as a gateway to build trust in an organization, to get counseling if you need it, to connect with group therapy if you need it, and so forth and so on. But like making that accessible really came down to the design of that space as well as what the organization offered as services.
Well, I hope that it's a bit eye-opening for people listening, that the intricacies and the thought and the commitment that goes into planning these spaces goes so much more beyond just well-intended.
Mm-hmm.
It takes literal effort and teamwork to sit down and really explore these opportunities, but then also the conscious effort to analyze what these spaces are, how they're working, how they're functioning, and learn from those things and make these designs. I like to use the term dynamic design.
Mm-hmm.
We do it in construction all the time. How do we learn from what we're doing, improvise, adapt, and improve? And for us working in behavioral health spaces, we do a lot of occupied behavioral health space. And that
really
in and
difficult.
of itself, very difficult. It's not a space where any builder can walk in and say, hey, yeah, we can do that. It involves another dynamic where the patients become almost like a part of the team, because it really is a collective, cohesive effort in those design builds and the renovations within occupied space. So I think that it's important for people to hear all these different perspectives on what goes into efficient design. And I love the fact to be able to get you on to talk about it on the tail end of your award, because it shows that it's working and being recognized. And I think that is what I always want to take away from these conversations, is the future is bright. There's a lot of optimism and hope that we can come into a new generation, a next generation of spaces that support healthy living.
No, absolutely. And I think that one phrase we use a lot is that design, you can defy stigma by design. And one reason why stigma exists, I think, in a lot of ways is it's a really difficult conversations. Either very impacted someone very personally or in their family. There's a lot of uncomfortable emotion with that. And I think opening up and being vulnerable to it is one way of sort of offering trust and hoping that trust is returned in that process, especially when you talk to patients' families. Because their pain points becomes design drivers, if you will. Because then you can address the experience of someone sitting in a room for the first time and the door is locked behind them and they start counting every single bolt and nut and screw on that door, because it implies that someone doesn't trust them to not stay in this room. And therefore, maybe they don't trust themselves. Any number of scenarios like that. And so we need to be ready and willing to have really difficult conversations about really uncomfortable topics so we can overcome stigma and do so in a way that isn't traumatizing to ourselves or others as well. There's a lot we talk about in terms of trauma-informed design and working with good partners who understand that. For example, like contractors, other designers, our clinician partners, the facility operators, everyone who sort of has an input in the design process. In the UK, they call it co-production. And I think their big aha moment, or for me at least, was hearing that it's not about like having a stakeholder group or a survey and kind of checking the box. you have somebody with lived experience, you have all these different stakeholders who may not necessarily always be in the room, but whose voice is really critical. And they help craft the care culture and the model of care, as well as the design and the process that creates that facility. And that is just something we don't necessarily come across very often in North America, right? So integrating that stakeholder perspective, those with lived experience, and making sure those pain points become design drivers, I think is really important. So that way the contractor knows, hey, I can't substitute this product for something else that's incarcinial or corrections-based, because it looks institutional, and the way it's supposed to operate is intended to prevent patient autonomy and dignity. Yeah, it might be psych safe, but it's not really providing a therapeutic environment. And it's the understanding of that concept down to the interior designer and the wall finish. Hey, this is probably not the best wall finish for a bathroom, but how do I create something that is more hospitality oriented instead of hospital looking, for example? Or the facility folks who, Lord love them, they overcome so many issues when, we turn over the keys in an O&M manual and something inevitably goes wrong, or they have to sort of fix something, or issues come up that no one really ever thought about. And that's the thing is, they come and they find workarounds, and they're trying the best they can. And you look at their design solutions, like, you got a really good idea here. How do we find a better way of doing this? Because you had a problem, let's find a design solution for you. And that's a lot of what we walk into existing facilities is like they really made do with what they had. And hopefully the investment in these spaces is really increasing. We've seen a lot of that. We've been very busy around the country, around North America and beyond, with the investment in mental health and behavioral health spaces, because people are really kind of seeing that demand, and they're all sort of wanting to pitch in where they can, how they can, which is really great.
Well, and I couldn't think of a better way to close this out than just the overwhelming optimism. It really is. And it's something that we all deeply care about in the industry, because it is a team effort, like you said. And so it's great to connect with you and people like Stantec and just talk about it, because I don't think a lot of people know. It's not that they don't appreciate it. They just don't realize what goes into creating these spaces to support rehabilitation, mental health, and giving people opportunities to live the best life that they can. And so I really appreciate it, your time coming out. Congrats on the award.
Thank you, Ian.
And, if tune in next time, maybe we'll get you back on when you come for round 2, huh?
Yeah, I do find myself in Chicago on occasion, and I appreciate the opportunity, Tony. Really great to hear this kind of content and the conversations you're fostering. And hopefully we'll hear more.
Well, thanks again, man. I appreciate it.
Yep.
Take care.